In late summer of 1918, the flu virus returned to America, but this time it was far more deadly. In August, a ship full of sick people arrived in New York City from Europe. 4 men had already died at sea, and 200 more people on the ship were sick. Many were taken to hospitals, but they weren't quarantined. In the following week, several more ships full of sick people arrived. The same was happening in other deep-water ports, like Boston, Philadelphia, and New Orleans. At the same time as the virus was arriving and spreading in ports, ships left those same ports headed for Canada, Central America, the Caribbean, and South America. By mid-September, thousands of men were sick, in many cases violently so. Of those who were sick, 75% were so ill they had to be hospitalized. The sheer number of patients overwhelmed the medical staff of the military hospital. The hospital had been designed to treat a maximum of 1,200 troops at one time, yet more than 6,000 patients were crammed in. Cots were stuffed into every available space, in hallways and offices, even on outdoor porches. The doctors and nurses fell ill. There were simply not enough healthy people to care for the thousands of sick people. So many died that they couldn't all fit in the hospital morgue. Within 2 days of the first cases, the flu was widespread throughout the camp. Within 4 days of the first case, men started dying. Within 5 days, doctors and nurses became sick and started dying. By 6 days, there were 4,000 men admitted to the hospital, and they converted 10 barracks into temporary hospitals. By 7 days, they were running out of medicine, disinfectant, and other medical supplies. They tried to make enough face cloths to cover people's mouths to fight the spread of germs, but they ran out of cloth. Civilian health officials called for an emergency quarantine of Camp Grant, but the virus was already out. Yet when hundreds began dying, the medical staff at the hospital stopped keeping careful records. They were just too overwhelmed by all the dead. Although the troops were segregated from others in the ship, they still shared the same mess hall where they all ate. They would file through, breathing the same air and touching the same tables and chairs as the group before. On one ship, called the Leviathan, the flu broke out almost immediately, despite the quarantine efforts. Within 2 days, it had overwhelmed the ship's medical services. The doctors and nurses were laid up sick alongside their patients. At first, they wrote the date and time of death, the name and rank of the deceased, their unit, and cause of death. But only 1 week after leaving New York, the officers were so overwhelmed they wrote only name and time of death. The captain's log shows 2 deaths at 2 a.m., 1 at 2:02 a.m., 2 at 2:15 a.m. It continued like that around the clock. However, the very worst outbreak probably occurred in Philadelphia, and it was made immeasurably worse by mismanagement by leaders who ignored warnings from public health doctors. Had public health measures been implemented, perhaps much of the death and suffering could have been avoided. I had a little bird. Its name was Enza. I opened the window, and influenza. Children's jump roping song, 1918. A ship full of 6 sailors arrived into the Philadelphia Navy Yard in mid-September. Within a few days, the Navy hospital was overrun, and the Navy began sending sailors to civilian hospitals in the city. As sailors began dying, the flu spread to civilians. 2 days after the first sailor arrived at the hospital, multiple doctors and nurses felt fine as they started their shifts, yet collapsed and became desperately ill within hours. However, the health board for the city didn't want people to panic. They downplayed the severity of the disease. After the death of several sailors and civilians, the health board confidently declared the disease had reached its zenith and already begun to decline. It hadn't even gotten started. And Philadelphia was ready to hold the Liberty Loan Parade to sell war bonds. Public health doctors begged the city to cancel the parade, terrified that it would cause the outbreak to become an epidemic. The city government ignored them. On September 28th, hundreds of thousands of people jammed into the downtown streets to watch the parade. In that huddled crowd, all crushed together, it only took a few coughing, sneezing people to launch the epidemic. Within 76 hours, just 3 days later, the city's 31 hospitals had run out of bed space. They were completely full. Some hospitals tried to cram in more by laying patients on cots in the hallways, in offices, and on balconies. In some cases, the sick were laid on the floor next to a dying patient. Once the patient died, the body was taken away, and the new patient would be lifted into the same bed, still warm from the previous occupant. The city opened several temporary emergency hospitals, but it wasn't enough. Hospitals started refusing to accept any more patients. People lined up outside begging to be let in. Some died standing in line. Even for those who got in, care was non-existent for most people. The hospitals ran out of medicine. The doctors and nurses were overtaxed, and they were dropping from the flu. They were desperate for help. People with no medical training volunteered. Physicians and nurses came out of retirement. Medical schools closed, and first-year medical students were put in charge of an entire floor of a hospital. One medical student reported that during the height of the outbreak, 1/4 of all the patients in the hospital died every day. The number of dead kept growing. 5 days after the city held the Liberty Lyon parade, city leaders finally acted. The health department banned all public meetings. Churches, schools, and theaters were closed. They left the bars open, but those too were closed the next day. The courts closed and city services shut down. It took only a few days for the city's operations to completely grind to a halt. Within just 10 days, Philadelphia went from a few hundred cases of flu and a couple deaths per day to hundreds of thousands of people sick and hundreds dying every day, all because they ignored public health guidelines. By 3 weeks after the parade, the death toll stood at 4,500. Everyone was terrified. People avoided each other. People couldn't get food because no trucks were delivering goods in the city. The streets fell silent. Every business was closed. People hid inside their homes. The streetcars stopped. The police cars stopped. The entire city ceased to function. Leaders begged for more help, but people turned away. The fabric of society began to break down. City leaders who hadn't bothered to attend meetings of the outreach effort finally got involved. They seized the city's emergency fund to pay for supplies and pay health workers. They opened additional morgues and sent out policemen to try and clear the piled-up bodies. By late October, the epidemic was finally beginning to loosen its death grip on the city. In its aftermath, it left a death toll of 13,000. It also left thousands of orphaned children, a shortage of food and goods, and a stalled city that had to slowly grind its most basic services back into motion. Finally, it left a changed people. In other cities and towns across America, the news was the same. In New York City, 33,000 people died before the statisticians stopped counting. Some small towns tried to keep the virus out by quarantining themselves. They shut down all businesses and canceled public gatherings. People were ordered to stay in their homes and not touch or visit others. Some small towns tried to keep the virus out by quarantining themselves. They shut down all businesses and canceled public gatherings. People were ordered to stay in their homes and not touch or visit others. The only place that escaped the worst of the wrath was San Francisco, and historians credit that to aggressive response by the local government, who listened to their public health officials. Public Health Director William Hassler quarantined all naval stations before they had any reported cases. He knew it was only a matter of time. He ordered all public schools and gathering places closed. The city's government, medical, and civic organizations banded together to educate citizens on prevention such as hand washing, avoiding public places, and wearing a face mask. While Philadelphia's government was still denying there was a problem, San Francisco authorities were distributing 100,000 face masks. As the second wave diminished throughout the country, San Francisco rejoiced for having missed the flu. The flu would mutate once more and rage through the world for a third time, but infecting and killing fewer people. This time it would be less severe. This time it did hit San Francisco, because they thought the flu was already over. The third wave hit the Southwest and Midwest hard, but for the rest of America, the worst of the flu had passed. Even as America woke from the nightmare, the epidemic had left its imprint. Right at the height of harvest time, farmers had been too sick to farm, and workers didn't show up to gather the food in. Food that was harvested rotted in warehouses because there was no one to transport it. There was a lag while the country tried to catch up on shipping food and goods, and store shelves and markets stayed empty for some time because goods hadn't been delivered. The flu killed an estimated 3% of the entire world population. In Latin America, the flu killed 10 out of every 1,000 people. In Africa, about 15 out of every 1,000 died, and in parts of Asia, the death rate was as high as 35 per thousand. In Tahiti, it killed 10% of the population, and in Western Samoa, 20% of the population died. So could it happen again? Yes, it could. As Burke said, When it comes to the probability of a pandemic flu, I think everyone would say it's not if, it's when.